we continue to retrain the way that the body is operating, those improvements, those health changes start to hold for longer and longer and longer until they're not really a problem anymore.
I still sleep on my right side.
Yeah.
Which is working.
Love it. We always ask people when they first come in, what are your health goals? For someone like Steve, the most important thing was we needed to know where it was limiting him. What are the health goals that he has? How do we make sure that we reach those goals?
If I sleep on the left side, it pushes on the pinched nerve, so it makes the pain worse. I have trouble sleeping on the left side anyhow, but it just makes it worse with the pinched nerve, where if I sleep on my right side, it helps the pinched nerve and I sleep better on the right side.
We were working on his frozen shoulder, and his shoulder responded beautifully, right?
Yeah.
And one of the things that we noticed was that there was a bump on the side of his tongue right in the area that we relate to the shoulder. And then a number of weeks later, when we went and rechecked it, that bump was not only smoothed out, but there was a dark red area that was no longer there. So we wait a number of weeks before we recheck it and take a new picture. The pulse can be very dynamic. Sometimes you feel a change in the pulse just from the beginning to the end of a treatment. The trick with the pulse is we want to see that change hold. So we want it to stabilize, just like we want your improvement to stabilize. We continue to retrain the way that the body is operating. Those improvements, those health changes start to hold for longer and longer and longer until they're not really a problem anymore. And the pulse is the same thing. You know, you see these little vibrations that disappear, and then they'll pop back up the next week when the person comes in, or 3 days later when the person comes in. And then all of a sudden it's like, oh, that vibration hasn't been here for a number of weeks. Fantastic. That's a sign that internally things are really shifting and the body is really being retrained.
I still sleep on my right side.
Yeah. Yeah, so one of the things that Steve said, we always ask people when they first come in, what are your health goals? And we really are looking for specifically, what are the activities that you can't do, that you would like to be able to do? And, you know, because shoulder pain is shoulder pain. We want it to go away. Great, but why? You know, what are the things, how are we going to know that it's really affecting your life in a positive way? Is 10% going to make a big difference? Probably not. But when you are a side sleeper and you sleep better on your side, and you can't sleep on your side because of the pain, and then 6 weeks later you can, and you're sleeping through the night, and you know, first it was I slept for a few hours on my right side. I couldn't believe it, right? And then it was I woke up in the middle of the night, but I had slept for 4 hours on my right side, and then it was all of a sudden I slept all the way through the night on my right side.
Sleep on my right side every night.
Yeah. We're always going to ask about the history of what's going on. When did it start? How long has it been going on? How intense is it? There's three main parameters that we're really trying to affect, right? How intense is the issue, and can we reduce that? How frequently are you experiencing it, and can we reduce that? And how quickly does your body recover when you do get that, when it's improving and you're getting a flare up of whatever that issue is? How quickly does your body recover on its own? Our goal is to get your body to fix itself, right? So at the beginning, we're doing a lot of work on you. Treatments, supplements, stim, things that might help. And then as you improve, we start to do less because your body is doing more. And so ultimately, we want your body to do it all, so that when you do pick up that suitcase in a funny way and you feel a little twinge in the shoulder, instead of going all the way back to now I have a frozen shoulder again, we want your body to have that message of healing so that it just does it on its own. For someone like Steve, the most important thing was we needed to know where it was limiting him, right? Which we were talking about before. What are the health goals that he has? How do we make sure that we reach those goals? For some people, that may just be being able to reach up and grab a glass off the shelf. For other people, it might be, I want to lift weights overhead, right? There's a big range of what's important to that individual. And so we want to first know that we're operating from that place. That way, when we decide, when we're trying to determine what's the best treatment plan for that person, we know what we're shooting for. We know what the ultimate goal is based on your assessment of yourself, you know, what's important to you. Our philosophy here is very much about collaboration and integration. There are a lot of medical doctors that are not interested in their patients doing things outside of what they've prescribed for their health. At the same time, there is also a lot of acupuncturists and chiropractors that don't want their patients to listen to what their medical doctors say because, it's not natural, it's not holistic, it's not in that realm. We are here to integrate. We're here to work with your medical doctor. We're here to work with your physical therapist. We try to mold around what you're currently doing. So if you're on medication, we just talk to you about, how long you've been on it. Are you interested in trying to come off of it? Would your doctor support you coming off of it? And all of those things are prerequisites to any kind of work that would go in that direction. Same thing with if you're currently going to physical therapy and you really want to, you've plateaued a little bit or you're just not getting where you want to be. Sometimes having an extra modality that's going to really focus on tissue repair as opposed to just strengthening the muscles around the area can be really effective. And so if you're doing physical therapy 3 times a week, we're not going to tell you to come in for acupuncture 3 times a week. We're going to tell you come in once a week, and we will choose to be the supportive therapy. If you come here first, we're going to tell you to come in 3 times a week so we can really heal that area, and then go to physical therapy, or do physical therapy once a week while we're working on tissue repair. So there's so many ways that we can work with your other professionals in the health space. Then we'll take that into consideration and how quickly they want it to improve, right? So a lot of times with something like acupuncture, where you're trying to retrain the way the body's operating, there's a certain amount of treatment that is going to be necessary in order to help it get over the hump. If you come in once every 2 weeks, it might take 6 months. But if you come in 3 times a week, it might take 4 weeks. And so we will help talk with the patient, what's important to them? How quickly do they want to recover? Are there any other concerns that would keep them from being able to fulfill a treatment plan of, say, 3 times a week? Some people have difficult work schedules or things like that. So we try to make sure that our schedule is open enough. We have enough evening hours, enough Saturday hours, where if he wants to be able to sleep on his side within 4 weeks, we're going to try and get him there within 4 weeks. And so that was our goal, and that's what we did, right?
Worked.
Yeah. And we treated it a few times a week at the beginning, right? And then we went down to once a week, and then we went down to every other week, and then I think we did a couple at once a month, and then off we went. So fantastic.
It's working.
Love it. Very good, sir.